So let's start with the topic. The topic is sensory, and you all are aware, and you have come here because you must have faced something. Maybe you faced it as a problem, maybe you faced it as a subject which you wanted to study more, maybe you wanted to know the treatment. So basically, sensory is something that whenever we talk about children, not just with autism, in fact, it should be clear that sensory integration is not discussed or treated or evaluated for children with autism, but rather it is a independent entity in itself also, which means you can have sensory issues without having autism also, right? So is that because sometimes we consider that if you have sensory means you will have autism, or if you have autism you will have sensory. Nothing like that. But of course, autism diagnostic criteria has now included sensory, right? So what can we say in summary is, all children who have sensory issues do not have autism. Most children who have autism have sensory issues. Is that okay? Most children who have autism have sensory. Most means 90%, maybe more than 90%. The data is a little variable. However, since it has been added as a diagnostic criteria also, it is understood that if you have this diagnosis, then most probably you are likely to have some of the other sensory issues as well, right? But not all children who have sensory issues will have autism.